Hi, today I'm bringing you a case about my approach with the 12 magic points. As most of my students probably know, I'm not a big fan of the 12 magic points because it is a very general application of the balance method, so a very general protocol, and I usually prefer an approach that is more direct to a given problem. So if I'm treating pain or if I'm treating internal medicine problems, I prefer to do a full diagnosis and treat specifically for each problem and not an approach as broad as the 12 magic. That doesn't mean though that there isn't a situation in which the 12 magic might be the right choice. And today I'm bringing you a case where I chose to use the 12 magic, and I'm going to use this case to explain to you when I use these protocols. I'm not going to go very deep within the theory behind the 12 magic or explaining how you apply the protocol. If you want to learn more about it, leave me a note in the comments and I will make a video specifically on the 12 magic points. This case was a female of 40 years old. She had a history of autoimmune disease, in particular ulcerative colitis and also psoriasis. She had recently had COVID and she had to be admitted to the hospital with a colitis crisis after suffering from COVID. When she called me, she was suffering from a very complex group of symptoms. She was still in a crisis with ulcerative colitis. She had diarrhea and a lot of ache around the intestine area. She also lost the hearing on her left side after the COVID incident, and she was having a lot of joint pain, particularly in the knees. It was the worst, but all her joints hurt. She was feeling fatigue, loss of breath, and she was also having trouble sleeping and anxiety problems. This case was so complex with so many different symptoms that were unrelated in some cases that I decided to use the 12 magic in the beginning. And this is where I see the 12 magic points shining, is when you have a very complex case, you can use the 12 magic to clean up the mess, so the secondary symptoms will start clearing up, and after that you can go in deeper with a more specific protocol for the root cause of the patient's problems. So I started this case with the 12 magic protocol, and what I did was this. I chose as limb number 1 the arm, and I used yin points. So I started with lung 11, heart 9 and pericard 9. Then I went down to the leg using stomach 43, gallbladder 41 and bladder 65. On the other side, I went for kidney 3, splint 6 and liver 5, and finished on the other arm using large intestine 11, sanjiao 10 and small intestine 8. Why did I choose this pattern? Although theoretically all patterns are equivalent, I wanted to use this specific pattern because the pain in the knees that the patient felt was worse in the spleen channel area. And by using here sanjiao 10 and small intestine 8, I was able to balance using both system 2 and system 4, the spleen channel and image the knee. And as you know, both system 2 and system 4 treat bilaterally, and since the problem was bilateral, I thought that this might be the confirmation of the 12 magic that might help more in this specific case. If you like this kind of content and you want to learn more about the techniques I show in my videos, check out the courses I have available. The links are in the description. I have courses available in Portuguese and also in English. To this protocol, I added the YNSA, cranial nerve 8, which is the auditory vestibular nerve, and this was to try and address the loss of hearing on her left side. And I also added a Dauma that I learned from Sean Goodman, or an approach on a Dauma, which is Yin Tang plus Do 22 plus Do 20 to address the anxiety. After the first treatment, the condition started clearing up and the main symptoms started to be more evident. So what we saw was that the hearing loss was completely recovered. The tiredness that the patient felt was also a lot better, less anxiety. The pain in the joints started going down, particularly in the knee. And so the symptoms, or the main symptoms that we ended up with, were the digestive symptoms, so the diarrhea and the pain in the intestine area. It was the psoriasis. She still had a few areas which were very red and with some injuries, and it was also the shortness of breath and a bit of the fatigue. So here I went for a deeper diagnosis to start and create a protocol specific for this problem. After checking the pulse and the tongue, and of course talking with the patient, asking a lot of questions and analyzing the symptoms that remained, the signs that I saw were, first of all, stagnation both of qi and blood, a serious qi deficiency, and some heat and humidity, particularly in the Yangming and lower burner. With this, I decided to start a treatment based on a global balance, as I usually do, and I decided to go with a Tai-Yin Yangming balance because, as we know, the Tai-Yin and the Yangming are very involved in the flow and the capacity of the body to get qi, and also using the Tai-Yin I have the lung, which will address the skin problems, and I will also be able to treat the heat and the humidity in the Yangming. So the balance that I designed was lung 5 plus lung 9, Lingu and Dabai, and also large intestine 11. On the legs, I went for Splint 9 plus Splint 3, and on the other leg to finish, I used the 4 horses and 6605. I also kept Yin Tang. Even though the anxiety was better, the patient was still a bit anxious, so I decided to go with these points. And why did I choose these points? For the qi stagnation and the blood stagnation, I wanted to create movement, and lung 5 with Splint 9 is a Wang Ju Yi combination, which I find to be the best combination to move the qi and, by consequence, to move the blood. Lingu and Dabai also work very well to move qi, and I find them also very effective to treat digestive problems. as we were seeing with the diarrhea and the colitis. The 4 horses, of course, are one of the best daumas to treat the skin, as we know, and also to balance the lung for the shortness of breath. Lung 9 will create a bridge between the lung and the earth, as it is an earth point in the lung channel, and I also like it very much when we have shortness of breath problems. 6605 on the stomach channel is very good to balance and regulate the whole stomach channel. It is also very good to treat heat. And of course, being on the stomach channel, it will also work on humidity. And the same for Splint 9. Splint 3, if we look at the name of the point, it is the big white or the biggest white. White is the color of the lung. So when I'm treating lung using the spleen, I always like to use Splint 3 because I see a connection here between the 2 channels, even more than the connection we already know from the tie-in. And to finish, of course, large intestine 11 is a great point to take care of heat in the young Ming, and is also a fantastic point to treat heat in the skin, such as psoriasis can be, and it is a good image of the lower abdomen. After the first session with these points, the patient told me that shortness of breath was pretty much solved, so she wasn't feeling it anymore. She wasn't feeling any more fatigue. The problems we treated with 12 magic didn't come back, and the diarrhea and pain in the lower abdomen were also almost solved. So she still felt a little bit of problems in that area, but very mild. As for the psoriasis, there weren't any new lesions, but the ones that she had were still painful and some of them were not healing yet. So I decided to maintain this treatment exactly as the one that I showed you before, but I also added here the point 11 points. 26 or control dirt, which I bled in the hand. This point is fantastic to enhance the body's capacity to heal wounds or to treat wounds that won't heal. Then in the next session, the patient reported that the wounds were starting to heal, and I could see it, that all the lesions from the psoriasis were starting to dry up, and that the digestive part was now completely normal. I kept the same protocol now without 1126 because its work was already ongoing and all the symptoms were controlled. Now I keep treating the patient once a month because it helps to maintain autoimmune problems under control, but she is completely without symptoms. If you like this video, don't forget to like and subscribe. Also, if you have suggestions or questions, leave them in the comments and I'll answer them as soon as I can.